Follow the universal steps that apply.
morning. My
Identify
name's
the
Mimi.
patient according
I'm
to
gonna
agency
resuscitate you this
policy.
morning.
Explain what you're going to do, and attend appropriately to standard precautions, hand hygiene,
Can you tell me
safety,
your name?
privacy, and body mechanics. Place the patient in semi-Fowler's position unless contraindicated. Place the linen saver pad or towel on the patient's chest to prevent soiling of the patient's gown during suctioning. Don a face mask or goggles and a gown. Turn on the oxygen and the wall suction or portable suction machine. Adjust the pressure regulator according to agency policy, using the lowest possible suction pressure in order to prevent tissue trauma. For adults, this is typically 100 to 150 millimeters of mercury. For children, 100 to 120 millimeters of mercury, and for infants, 50 to 95 millimeters of mercury. Don a procedure glove. Test the suction equipment by occluding the connection tubing. Remove and discard the glove and perform hand hygiene. Pour the sterile saline or water into the sterile container. Open the suction catheter kit or the gathered equipment if a kit is not available. Don sterile gloves, but consider your dominant hand sterile and your non-dominant hand non-sterile. Follow agency policy, as some guidelines allow for clean procedure gloves. Pick up the suction catheter with your dominant hand and attach it to the connection tubing. Do not touch the connection tubing with your sterile glove. Put the tip of the suction catheter into the sterile container of normal saline solution or water. Apply suction by placing a finger over the suction control port of the suction catheter and suction a small amount of saline. If the patient is receiving oxygen, hyperoxygenate the patient according to agency
Verna, I'm
policy,
gonna give you a
as
little
this
oxygen
nurse
here, okay?
does. Attach the resuscitation bag to the tracheostomy tube and hyperoxygenate the patient by compressing the resuscitation bag 3 to 5 times as the patient inhales. Use your non-sterile hand to do this. Have an assistant perform hyperoxygenation if necessary. If the patient isn't receiving oxygen, you don't need to hyperoxygenate. When you have finished, remove the resuscitation bag and place it next to the patient. Lavage with a few drops of normal saline into the tracheostomy opening and hyperoxygenate again if prescribed. Newer guidelines no longer recommend this, but a physician may prescribe it in certain situations, so this nurse demonstrates it.
Oh, that's it. You ready?
Using your dominant
There you go.
hand, gently but quickly insert the suction catheter into the tracheostomy tube with the suction off. Do not force the catheter. Insert the suction catheter to the pre-measured length, being sure to go no further than the carina trachea. Do not insert the tube more than 15 centimeters or 6 inches. As you withdraw the catheter, apply suction and rotate the tube, rolling it between your thumb and forefinger. Apply suction for no longer than 15 seconds. Repeat suctioning as needed. Remember to allow at least 30-second intervals between suctioning. Be sure to hyperoxygenate the patient between each pass and limit the total suctioning time to 5 minutes to prevent trauma and hypoxia.
How's that feel? Is that enough?
Coil the suction catheter in your dominant hand or wrap it around your dominant hand and pull the sterile glove off over the coiled catheter. Discard the glove containing the catheter in a fluid-resistant receptacle designated by your agency. Replace the oxygen source if it was removed during suctioning. Don clean procedure gloves and provide mouth care to clear the mouth of secretions and bacteria, which may place the patient at risk for pneumonia. Using your non-dominant hand, clear the connecting tubing of secretions by placing the tip into the container of sterile saline or water. Shut off the oxygen and suction units. Finally, reposition the patient and ensure she is in a safe and comfortable position.
Okay, Verna.
And wash your hands.
I'll see you later.